It is now time for private members' business. Private members' public business. Orders of the day.
Ballot item number 23, Order M200, second reading of Bill 200, an act to amend the Employment Standards Act 2000 in respect of sick notes. Mr. Schreiner.
This one? Where? I recognize the member for Guelph.
I move second reading of Bill 200, an act to amend the Employment Standards Act 2000 in respect of sick notes.
Mr. Schreiner has moved second reading of Bill 200, an act to amend the Employment Standards Act 2000 in respect of sick notes. Mr. Schreiner. Pursuant to Standing Order 101, the member has 12 minutes for his presentation. Mr. Schreiner.
Thank you, Speaker. I'm honored to rise today to speak to my private member's Bill 200, an act to amend the Employment Standards Act in respect to sick notes. Bill 200 would permanently revoke the ability of employers to require sick notes for minor illnesses. Speaker, we have learned many lessons from this pandemic, and one of the most important lessons is that if you feel ill, stay home and get better. This keeps you safe, your colleagues at work safe, people in the doctor's office safe, and members of the public who you might encounter on the way to visit the doctor safe. Ontario's labour laws used to reflect this basic public health principle until the government reintroduced sick notes in 2018. Forcing someone to visit a busy doctor's office just to prove that they are sick was bad public health policy in the before times. But during a pandemic, it's actually outright dangerous. And so we have an opportunity to fix this with Bill 200. Speaker, as the COVID-19 virus was entering Ontario in February, health advocates were sounding the alarm. 175 healthcare workers, part of the Decent Work and Health Network, wrote an open letter to the Premier in which they stated, and I quote, "In the context of recent concerns with the novel coronavirus in Ontario, we consider the current provincial labour laws to be a serious threat to the health and safety of Ontarians." They went on to say that requiring sick notes goes against all public health advice that urges people with mild illnesses to rest at home and not expose others to infection, particularly vulnerable patients at busy medical clinics, end quote. Speaker, I will give the government credit for listening to one of their requests, and I encourage the government to consider their other requests. A month later, as the first wave of the virus was taking off, the government introduced a bill to revoke the ability of employers to require routine sick notes for minor illnesses on a temporary basis due to the pandemic. I voted for this bill, and I pushed unsuccessfully at the time to make this change permanent. But we must make it permanent now, because the temporary ban on routine sick notes expires in January. Speaker, I would like to go through some of the reasons why I feel this bill is so important and why I believe all members of this legislature should support it. First, this bill is about respecting workers, especially those workers we have all called heroes during this pandemic, workers who have cared for our loved ones, and workers who have made sure that the essential goods and services that we need to get through this pandemic are there for us. We should trust these workers when they say they are ill and allow them to stay home, rest, and get better. We should not treat them with suspicion and ask them to prove their illness. This is not how we should treat workers who are sick. This is not how we should respect working heroes. We should not ask them to have to go to a doctor's office and shell out $40 for a sick note. Now, I know there are some concerns about absenteeism and people who might abuse their sick time. As a longtime small business owner, I get it. but we have other ways to deal with absentee workers. And we should not have dangerous labor laws simply to police a few workers. Because, Speaker, the reality is that if we force workers to go through the red tape of getting a sick note, many of them will not stay home and simply go to work. According to a recent Ipsos poll, 82% of workers said that if they were sick and their employer required a sick note, they would not stay home and they would actually go into work. And that, Mr. Speaker, is the crux of the issue. Allowing employers to demand routine sick notes puts everyone at risk. It does much more harm than good. It will bring more illness into the workplace. In schools and restaurants and meatpacking plants and nursing homes, we've seen the headlines, viruses spread in workplaces. Speaker, this pandemic has been such a lesson in the importance of public health. And it makes no sense for government to plead with people to stay home if they're sick if we have laws on the books that actually tell them to do the opposite. We can fix this by passing Bill 200. Which leads me to my second point. Sick notes are completely antithetical to responsible public health. They put unnecessary pressures on the finite resources available to our public health system. I'd like to read a letter I received from a Guelph physician last year, and I quote, "I'm writing you today in response to the Ontario government's action to reinstate the ability of employers to require their employees to provide sick notes for short illnesses related to absences from work. As a physician practicing in this province, I'm concerned with the negative consequences of reinstating this ability. This action counters the government's commitment to end hallway medicine. When employers were previously able to require sick notes, my practice would receive continuous stream of appointment requests for patients needing to supply their employers with sick notes for minor illnesses like the common cold. These requests were greatly diminished during the short time that this practice was prohibited. As a physician, I cannot support a policy that requires patients who are suffering from an illness to risk infecting others in waiting rooms or public transportation in order to seek a sick note when they would have otherwise stayed home to rest and recover. As a physician, I would rather be taking care of patients with serious needs rather than filling out sick notes for people with minor illnesses," end quote. And Speaker, this last point is so important. Physicians have better things to do than write sick notes for minor illnesses. It is fiscally irresponsible to spend our precious health dollars on routine sick notes. It's an unreasonable burden on doctors, a task they should not be wasting their valuable time and our valuable health care resources on. For a government who talks so much about cutting red tape, and that's what a lot of the debate has been about today, here is an opportunity for real red tape reduction. Speaker, this physician was not the only healthcare professional calling for an end to routine sick notes. The Canadian Medical Association said this when the government reinstated sick notes, and I quote, "Requiring sick notes can introduce unnecessary public health risk. Patients who would have otherwise stayed home may spread viruses or infections while out to get a sick note. For physicians, writing a sick note is added administrative work, time that should be spent providing direct care to patients," end quote. The Ontario Medical Association is on the same page because the last thing we should be doing is forcing infectious people into crowded waiting rooms where, A, they're not actually going to get treatment for their illness, and B, they risk spreading their illness to others in the crowded waiting room. So, Speaker, this brings me to my third point that I want to make, that it's not only healthcare professionals opposed to routine sick notes. Businesses and labor leaders have also reached out to me in support of Bill 200. The President and CEO of the Guelph Chamber of Commerce sent me a note, and I want to quote, "Prioritizing public health is our best long-term economic strategy. The Guelph Chamber of Commerce encourages the Ontario government to end the application of employer-requested sick notes under Section 50 of the ESA in order to ease the burden on our healthcare system and minimize people's exposure to the spread of illness. It's not just business leaders, it's labour leaders. The Ontario Federation of Labour said in a news release in support of my bill, and I quote, requiring employees to provide a sick note is not only a burden on an already overstretched healthcare system, but also poses increased and unnecessary health risks to the employee and the public health in general. Speaker, the Guelph Health Team, which represents most primary health care providers in my riding, wrote me in support of Bill 200, and I want to just quote what they had to say. Quote, the Guelph Family Health Team strongly urges the government to revoke any requirement for sick notes. By asking primary care providers to provide sick notes, we are taking away time from meeting the medical needs of patients. In addition, in most cases, it is difficult or impossible for a primary care provider to assess whether or not a patient is able to work. We encourage employers to work with their staff to build processes based on trust and respect and eliminate the need for medical notes. End quote. And Speaker, that's what this is about. Trusting workers, working together. It's not very common to see such diverse opinions on an Employment Standards Act bill in support of it. And so I want to close today by saying it was the right thing to do in March, when every party in this House voted in favor of a temporary ban on requiring routine sick notes for minor illnesses. We did the right thing then. And now we have an opportunity to do the right thing and make that permanent. Our labor laws should be about promoting the public good. And when people have symptoms of the flu or COVID-19 or any other disease that could be harmful to others, we need to let them stay home. We need to trust them. We need to believe them. We need to let them recover. And we need to protect others by not exposing them to an illness that could hurt them. I see Bill 200 as an important step, a first step, in improving the Employment Standards Act in a way that respects and supports all workers in Ontario. And I encourage my colleagues from all sides of this House to take that first step. Take that first step in improving the Employment Standards Act in a way that learns the lessons of what this pandemic has taught us. And that's why I'm asking all members of this House to vote in favor of Bill 200. Thank you, Speaker.
Thank you very much. Further debate, I recognize a member from Carleton.
Thank you, Mr. Speaker. Mr. Speaker, it's a pleasure to rise today in the Legislature to speak to this private member's bill introduced by the honourable member from Guelph. And I also wanted to congratulate the member on recently being voted in as Vice Chair on Standing Committee of General Government. And I'm really excited to work with the member moving forward on various pieces of legislation that passes through that committee. Mr. Speaker, I listened intently to what the member was saying, and I wanted to thank him for his feedback. He spoke a lot about employment standards and COVID, so I just wanted to reiterate some of the things that have happened since this pandemic really took over. Since the beginning of this global pandemic, our government's #1 priority, Mr. Speaker, has always been the health and safety of the people of Ontario. And I want to thank the member from Guelph for introducing this private member's bill to remove the option for employers to request a medical note from their employees. In this time of uncertainty right now, Mr. Speaker, I think it's critical that we discuss any possible ways we can improve the lives of Ontario's workers. We are all in this together, and we must all work together. COVID does not run across partisan lines, and health and safety should guide every decision we make. And so, Mr. Speaker, that's why back in March, the first move that our government made was to amend the Employment Standards Act to provide job-protected leave for employees who are unable to work for reasons related to COVID-19. And this was due to the rapidly evolving nature of COVID-19, Mr. Speaker. Because of that, our government is open to discussing any and all ideas that would better support the people of Ontario. And that's why, Mr. Speaker, I think supporting this private member's bill in second reading to allow for further review at the committee level on whether this proposed approach is the best interest of the people of Ontario is an excellent idea. Mr. Speaker, we agree that due to the infectious nature of COVID-19, going to a doctor for a sick note is not following the best available medical advice. And let me repeat that, Mr. Speaker. It's not following the current best available medical advice. And we welcome the debate from the member opposite. And we will take this opportunity to properly analyze any proposed legislation, including this one, Mr. Speaker, because ultimately, no one should have to choose between their job and their health. Every option is on the table when it comes to supporting the people of our province. Mr. Speaker, I want to just mention a stakeholder quote regarding this topic. And this was from Rocco Rossi, President and CEO of the Ontario Chamber of Commerce. And Mr. Rocco Rossi said, "We welcome the continued action taken by the Government of Ontario in response to COVID-19 with the passing today of the Employment Standards Amendment Act, Infectious Disease Emergencies 2020, and the Municipal Emergency Act 2020. And that, Mr. Speaker, kind of segues into the next part of what I want to speak about today with respect to the member's bill, and that's with respect to Bill 186. Again, Mr. Speaker, everything that we have done is to protect Ontarians and to keep them safe. And so with respect to workers, for example, our government has continued to make investments in the fight against COVID-19 by allocating more support for people, jobs, and a safe reopening. We have streamlined processes and reduced duplication to save businesses up to $338 million on an annual basis. We've provided grants of up to $1,000 for small businesses to help offset the unexpected costs of PPE. We've added mental health supports for families, for frontline workers, young people, children, and Indigenous communities. And these investments, Mr. Speaker, these investments bring the government's COVID-19 response action plan to a projected $30 billion. That is up from $17 billion that was initially announced in Ontario's action plan back in March. We've been taking actions, Mr. Speaker, to further reduce the burden on household budgets. We've taken steps like introducing fixed hydro rates at a COVID-19 recovery rate of 12.8 cents per kilowatt hour, childcare relief of up to $200 per child up to 12 years of age, emergency childcare options for our frontline workers. Mr. Speaker, we've also introduced $10 million to help community organizations deliver meals to seniors. And I'm firsthand aware of that, Mr. Speaker, because there's a nonprofit organization in my riding called Rural Ottawa South Senior Support Services, who have been taking advantage of this and similar programs to deliver meals to seniors on a weekly basis. Free meals, by the way, Mr. Speaker. And I was proud to join Ross on one of these meal deliveries to see the positive impact that they were having in the lives of rural seniors in Carleton. Mr. Speaker, we've also introduced $75 million to seniors to double their guaranteed annual income and a 6-month grace period on OSAP payments and interest for students. Mr. Speaker, ultimately, everything that our government has done and will continue to do is for the best interests of the people of Ontario. We have always been flexible. We will continue to be flexible. We will continue to listen, and I look forward to supporting this bill and having it go to second reading. Thank you, Mr. Speaker.
Thank you. Further debate. Recognizing a member from London West.
Good for you. Thank you very much, Speaker. I am pleased to rise today to speak in support of Bill 200, the private member's bill introduced by the member for Guelph. And Speaker, as I was preparing to participate in this debate, I decided to review the input that was provided to the committee that was looking at Bill 47. And as everyone in this chamber will recall, Bill 47 was the legislation legislation introduced by this government that reinstated the requirement for workers to have sick notes in order to take a day off work, and it also eliminated the 2 paid sick days that workers had previously had access to. And there were some interesting quotes in the public input that was provided to the committee. I want to quote Dr. Jesse McLaren from the Decent Health and Work Network. And what he said, I think, is very prescient in this moment of the COVID pandemic. He talked about this government's approach is making Ontario open for sickness. And certainly with the COVID pandemic, the cuts to public health, the undermining of public services that we had seen made us all that more vulnerable to the impact of the pandemic. But Dr. McLaren says, as an emergency physician, I depend on my patients to not come to hospital for unnecessary reasons like a sick note. He says that Bill 47, and we just finished a debate about red tape, but Bill 47 claims to cut red tape, but it brings back red tape of the worst kind. Demanding sick notes drives people out of their homes where they could be recovering and into overcrowded doctors' offices or emergency departments, wasting healthcare resources and putting others at risk. And Speaker, I just heard the comments from the member across the way about what this government is doing in the face of COVID and how they've eliminated the requirement under the infectious disease emergency legislation. But this is not just about COVID, Speaker. We heard a heartbreaking story at that committee from Jill Promoli. She's a mother. She lost her 2-year-old son after he contracted flu at the childcare he was attending. Speaker, without access to sick notes, or without eliminating the requirement for sick notes, and without giving people access to paid sick days, this is going to be happening across our province. And it's not just a COVID problem. It's a flu problem. It's any kind of infectious disease problem. Dr. McLaren talked about food handlers who have vomiting and diarrhea and symptoms of gastroenteritis, who are trying to figure out if they should go to work the next day, give up their, that day's income, or take the risk of handling food and serving customers, and many of them don't have a choice, Speaker. So I'm pleased that this legislation will remove one significant barrier to workers who are sick and shouldn't be at work. It will remove the requirement to get a sick note, but we really need to be looking at providing paid sick leave for every worker in this province, so they don't have to face that choice of whether to, stay home from work and not be able to pay the rent, get evicted, not be able to put groceries on the table, get their utilities cut off, or risk infecting their co-workers and their customers. So, Speaker, as the member said, this is a first step, but we have to go so much further. And if the pandemic has taught us anything, I hope it is that. Thank you, Speaker.
Thank you. Further debate. I'll recognize the member from Ottawa, Vanier.
Merci. Thank you, Mr. Speaker. I'm very pleased to rise today to speak in favour of this thoughtful bill tabled by my colleague, the MPP for Guelph. In 2018, this government brought back the ability of employers to require sick notes from their employees. From the beginning, this was not good public health policy. Emergency rooms and clinics across this province exist to provide urgent care, not to write notes for sick employees who are afraid of losing their jobs. Les notes médicales font perdre un temps précieux aux médecins et obligent les employeurs
sick notes
à payer le prix pour une exigence administrative qui n'a pas sa place.
cost too much time. If our government is serious, he should make sure that those requirements are abolished, because a lot of people show up to the hospitals and they shouldn't be there and waste our resources. What we learned this year is that sick notes is also a matter of public health care, and it can be dangerous. It contributes to spreading the disease. They cannot stay at home, like my colleague just said.
even more dangerous as our rates of COVID-19 infections increase. I agree with the well-thought rationale of the member for Guelph, and I hope every member will be supportive of this bill, which is about trust and about modern practice. Merci, Mr. Président.
Thank you, Mr. Speaker.
From Whitby.
Well, thank you, Speaker. I'm really pleased to be able to join the debate this afternoon introduced by the honourable member for Guelph. It's clear when the member of Guelph brings forward a bill to the Legislative Assembly, he brings it with passion and intent, which is apparent to all of us in the Legislative Assembly. Bill 200, the Employment Standards Amendment Act 2020, deserves further review and discussion. And that's what I would urge my colleagues in the Legislative Assembly this afternoon to support this bill. When you go through the bill, it's legislation that impacts every employer and employee in the province, Speaker, and the changes being brought forward should not be taken lightly. But I have confidence, as I do with the members in this chamber, and my colleagues on all sides of the aisle to thoroughly study and analyze the bill and bring forward their suggestions as we've seen in the past. Speaker, as we know, the COVID-19 pandemic has created many difficulties for families and the hard-working people of Ontario, including the constituents in the riding of Whitby, which I have the privilege of representing. But what's clear is that since the beginning of COVID-19, our government has been working hard to keep people safe in their communities and on the job. In that process, we've spared no expense when it comes to supporting the people of this great province. Back in March, when COVID first hit Ontario, the first piece of legislation we passed during the state of emergency was to protect the jobs of every employee in Ontario. Unanimously, and in the spirit of collaboration, this House agreed that due to the infectious nature of COVID-19, going to a doctor for a sick note is not following the best available medical advice. And that's why we amended the Employment Standards Act. And this change provides employees unprecedented job protection. Now, Speaker, to be clear, sick notes are not required for any worker who takes this leave. Bill 186 created an unlimited job-protected leave for issues related to COVID-19. If you stay home to self-isolate or care for loved ones, you will not be fired. This includes caring for children where schools or daycares are closed or operating with reduced hours because of COVID-19. Speaker, I've spoken now about the importance of carefully studying at committee the proposed legislation under consideration today, and I've highlighted the key features of Bill 186, a related bill that we passed earlier this session. Lastly, I want to speak about the importance of investing in the fight against COVID-19. Speaker, while I've noted the protections available to those impacted by COVID-19, and the end goal is defeating the horrible virus and keeping workers safe every day, and I know that's your goal too, Speaker, keeping workers safe every day so that they come home safe. And I think that's a goal that every MPP in this Legislative Assembly aspires to. Speaker, our government has continued to make investments in the fight against COVID-19. We have allocated more support for people, jobs, and a safe reopening. For example, we've provided grants of up to $1,000 for small businesses to help offset the unexpected costs of PPE. And we've added mental health supports for families, frontline workers, young people, and children. Yet another announcement today, Speaker, another multi-million-dollar announcement today of this government standing up for mental health, young people and children in our province. Taken together, and this is an important point to stay with, taken together, these investments bring our government's COVID-19 Response Action Plan to a projected $30 million. Let's come back to that, Speaker, $30 billion. This is up from $17 billion we announced in Ontario's action plan back in March of this year. We've acted decisively. We continue to act decisively, and we'll continue to do so every day and every month. We want every worker in this province to know that our government has your back. So if you're watching today, let me repeat, we want every worker in this province to know that our government has your back. And Speaker, thank you very much for the opportunity to speak on this bill today. The honourable member for Guelph, thank you for bringing forward this bill. I look forward to further discussion in committee. Thank you, Speaker.
Thank you very much. Further debate, the member from Parkdale, High Park.
Thank you, Speaker. I rise on behalf of the people of Parkdale High Park, particularly precarious workers, workers who are in low-wage jobs with no benefits, to speak in support of this bill. It is a crucial step forward to make the temporary ban on employers requiring sick notes permanent. Allowing employers to require sick notes puts our public health at risk, because sick workers spread viruses or infection while visiting doctors' offices and emergency rooms, while on public transit, while at work. It's bad for workers' health because they should be at home resting, not out getting a sick note. And it's a waste of healthcare resources that are already strained. Speaker, in November 2018, an Ipsos poll showed that 8 out of 10 Canadians would go to work sick if it meant bringing in a sick note. Both the Ontario and Canadian Medical Associations and the Canadian Association of Emergency Physicians oppose employers requiring sick notes for short-term illnesses. Speaker, it is important to note that banning sick notes will help some workers access unpaid sick leave. But taking unpaid sick days is not an option for workers living paycheck to paycheck who cannot afford to take an unpaid day off. No worker should have to choose between their health and their financial livelihood. Research shows that almost 60% of workers in Canada do not have paid sick days, and this number jumps to over 70% for those making low wages and is the highest for women workers. Those least likely to have paid sick days are those who need them the most, workers in precarious and low-wage employment. The failure of this government to implement paid sick days will continue to hurt low-wage women workers and also Black and racialized communities. Speaker, we're in the midst of a second wave of COVID-19, and it is shameful that our government has still not acted on paid sick days. It's a proven measure that will save lives. Recent research from the U.S. showed that paid sick days helped reduce COVID cases by 400 per day per state. Research also shows that jurisdictions in the U.S. with paid sick days saw 40% reduction of influenza during flu waves. But, Speaker, we've known for years that paid sick days reduces the spread of infectious disease. That is why healthcare providers have been advocating for 7 permanent paid sick days and an additional 14 paid sick days during public health emergencies. So yes, we need to ban sick notes, but we must also ensure that every worker in Ontario has access to paid sick days. Workers cannot wait any longer. Paid sick days saves lives. Thank you.
Thank you very much. For the debate, the member from Ottawa South.
Thank you very much, Mr. Speaker. So this is really about the numbers, so I need you to bear with me. So in 2017, Bill 148, the Fair Workplaces for Better Jobs Act, was passed that allowed 10 emergency days a year, 2 days sick leave paid, and no need for notes. It It also raised the minimum wage to $15 an hour over 2 years. Other supports that were very reasonable. Smart, progressive, thoughtful, things that workers deserve. Fast forward to the fall of 2018, we have Bill 47. And what happens there? The government cuts the increase to the minimum wage, eliminates the 2 paid emergency days, and reinstates sick notes. And then rolls back other gains that were made by workers in that bill. And they reinstated sick notes, despite the advice of public health experts, doctors, nurses, who simply said, it's a burden on our healthcare system, and you're going to make people sick. So they went ahead and did it anyways. So fast forward to 2020, COVID-19. We have Bill 148, the emergency measures legislation, which reinstates no need for sick notes. Interesting. After the recommendations of medical experts, they made that change. The same recommendations that they were getting before. So it doesn't matter whether it's the cold, the flu, or COVID-19, or some other infectious disease. Making people get sick notes is just not a smart thing to do. So now we get to Bill 200, right? As a member from Guelph, a bill that I fully support. It will once again make the change that Bill 148 made and reinstate no need for sick notes permanently, because the government's change is only temporary. Sorry, I'm getting mixed up in the numbers here, sir, Mr. Speaker. Here's the problem, though. Bill 47 still removed, changed the minimum wage, right? It still removed all sorts of the paid emergency days, the 2 paid emergency days. So that's still there, and that's a problem. So, and then we have my bill, which is 194, which gives WSIB to workers in retirement and group homes and other healthcare settings where workers doing the same work are getting coverage by WSIB, but some aren't, just by the way that the legislation is written. So, to sum it all up, Bill 148, the Fair Workplaces, Better Jobs Act, my bill, 194, and the member's bill, 200, all add up to something. The government's Bill 47 doesn't add up to much. Thank you, Speaker.
Thank you very much. Further debate? The member from Nickel Belt.
Thank you, Speaker. I'm happy to add my voice and my support to the member from Guelph bill to get rid of medical notes. This is something that I have spoken about in this House on numerous occasions. There was a law that came in Ontario, actually came into effect on January 2018, that we were not going to require sick note anymore. Then the Conservative government got in power and brought back the sick note. Then COVID came and we got rid of the sick note. And now we're back in the House talking about no need for medical notes. Speaker, I represent a northern rural riding. Nickel Belt is beautiful, 33 little communities, none of them big enough to be a city. We're a very nice place to live. But like many other northern communities, we have an acute shortage of primary care physicians or nurse practitioner. In my area alone, 30,000 people do not have a family physician or a nurse practitioner. They depend on walk-in clinics or the hospital for all of their healthcare needs. What does that mean, Speaker? That means that when your employer requires a sick note from you, you don't have a family physician to go to, so you go to a walk-in clinic. The physician at the walk-in clinic looks at you and say, you want a sick note? Yes. Yesterday, I had a really bad migraine, so I stayed home because I just couldn't go to work. My head was so. But now it's the next day, and there is no way for the physicians to really know, did you have a migraine yesterday or not? There is no way to know. But he will still charge you $25, and write you a sick note so that you can go back to work. What good came of that? Absolutely nothing. A complete waste of our healthcare system, a complete waste of respect for workers, but the law was there. Employers were allowed to require sick notes, and we have some big employers in Sudbury that require sick notes for all of them. A lot of you will know that I was not always a politician. I came from 25 years in healthcare. I was the executive director of the Community Health Center in Sudbury. And we know some of those big employers in town require sick notes for all of them. On Friday afternoon, at the end of the shift, we used to keep sometimes because people that had been sick Thursday, Friday, but felt like they'll probably feel better by Monday and wanted their sick note to go back to work, and we would book them all in at the end of the day Friday because they needed their sick note to be able to go back to work on Monday. But when the physicians or the nurse practitioners saw them on the Friday, sometimes they were not quite better. They were still coughing. They were still... And then, we were bringing all of those people in our waiting room, spreading their whatever they had with others, because by Monday they were hoping to feel better and they needed a sick note to go back. This has to go the way of the dinosaurs. We don't need sick notes. It's public health through the COVID has made it clear that it brings public health risk. We have a government that goes above and beyond talking about red tape. Well, this is a red tape that we can all agree on that nobody needs. And really, to send somebody to our healthcare system when they don't require treatment is really not productive. Ça me fait plaisir d'ajouter quelques mots.
I would like to add a few words to the bill that was submitted by the member of Guelph. We talked about sick notes many times in this legislative assembly, and it doesn't serve any good. It is time that we get rid of it. People have to stay at home and rest when they're sick. That's what the pandemic taught us, and that's why we're talking about that bill. Thank you.
No further debate. The member from Guelph has 2 minutes to reply.
Yeah, I just want to offer a sincere thanks to all my colleagues who spoke on this bill and those of you who spoke so eloquently in favor of the bill. Bill 200 is about respecting workers. It's about respecting healthcare professionals. And it's about bringing people together to fix a mistake that was made in 2018 when sick notes were reinstated. I want to read a quote from Charlene Stewart, the president of SEIU Healthcare, the person who represents the frontline healthcare heroes that we've all talked about during this pandemic. And she says, and I quote, "Bill 200 isn't just good for families, it's good for public health. It's especially good for precariously employed workers without paid sick leave who should be afforded the time to get well instead of clogging up our healthcare system." I'd like to thank Mike Schreiner for introducing Bill 200. I won't talk about the nice things she said about me, but I'll close with this. I encourage all parliamentarians at Queen's Park to support this legislation and then take the next step to expand access to paid sick leave for hard-working families. And the hard-working families that she's talking about, Mr. Speaker, are the frontline healthcare heroes that people have gotten together at night and banged pots and pans for, that people have tied ribbons around trees for, that people have put signs out in their front yards for, the people who have risked their lives to care for us and to care for our loved ones. They deserve respect. Respect not only in words, but in actions. And Bill 200 is a simple action we can take to respect those workers and all workers in the province of Ontario. Thank you, Speaker.
Thank you very much.